Medical lines and tubes with Brandy Jones. Common indications for portable chest and abdomen radiographs. ET tube placement, chest tube placement, central line placement, PICC line placement, pacemaker insertion, defibrillator, triple lumen, NG tube, OG tube placements, Delhoff placement, G tube placement, J tube placement, and dialysis catheter placements. The tracheostomy tube. An incision and/or opening is surgically created through the neck into the trachea and/or the windpipe to allow air to fill the lungs by passing the upper airway. Intubation, ETT placement. Endotracheal tube, commonly known as ETT. The tube end, when placed correctly, should be just above the carina. It is a hollow plastic tube that is placed in the trachea through the mouth. The trachea is also known as the windpipe or airway. The ETT is then attached to a respirator. Portable chest radiograph of ET tube placement. You can see the arrow on the first image right here pointing to the tube tip. And then second x-ray, you can see the arrow pointing to the tip here coming down. And you can see the carina very clearly here. So you can see it's good placement. PICC line. A PICC line may be requested for a variety of treatment options, which include some of the following: multiple access obtainable with one access line, IV access obtainable by less invasive and longer lasting methods, prolonged IV antibiotic treatment, chemotherapy, TPN nutrition, IV access related to physiological factors, home or subacute discharge for extended treatment. A PICC line is, by definition, per its acronym, a peripheral inserted central catheter. It is a long, slender, small, flexible tube that is inserted into the peripheral vein, typically in the upper arm, and advanced until the catheter tip terminates in a large vein in the chest near the heart to obtain intravenous access. This is a radiograph of PICC line placement. You can see it coming in on this left side, and it's coming in around and coming down into the SVC of the heart right here. Central line is used to administer medicines, fluids, and withdraw blood. It is an IV line that is inserted into a large vein, the superior vena cava, typically in the neck or near the heart for therapeutic or diagnostic purposes. This is a radiograph of the central line, and you can see the arrow pointing to the tip in the SVC of the heart. A triple lumen catheter is a type of catheter. You can have a single, double, or triple line. They are all considered central lines. So through different lumens or ports, medical staff can draw blood, administer fluids and medications. This type of catheter allows a healthcare professional to perform many different procedures without the patient having to undergo multiple needle pokes. A triple lumen catheter is a hollow tube inserted into the blood vessel, duct, or blood body cavity to keep the passageway open and allow for drainage or insertion of fluid. Attached to the catheter, but lying outside the body, is the lumen. Where three separate lumens are attached to a single catheter, it is called a triple lumen catheter. If you had a double lumen, it would have 2 outside the body. If you had a single lumen, it would have 1 outside the body. Chest tube. Chest tubes drain blood, fluid, or air from around your lungs. This allows your lungs to fully expand. The location of the chest tube will depend on the area where the lung has collapsed. The tube is placed between your ribs and into the space between the inner lining and the outer lining of your lung. This is called the pleural space. A chest radiograph of a chest tube. As you can see, it's been placed up into the apex of the right lung, and it has reinflated, and the arrow is showing you that it's reinflated. Pacemaker insertion. This device uses electrical pulses to prompt the heart to beat at a normal rate. A pacemaker is a small device that's placed in the chest or abdomen to help control the abnormal heart rhythms. This is a chest radiograph with a pacemaker, a defibrillator, an ICD. This device is programmed to detect cardiac arrhythmia and to correct it by delivering a jolt of electricity. It is an implantable cardioverter defibrillator, which is the ICD, is a small battery-powered electrical impulse generator that is implanted into patients who are at risk of sudden cardiac death due to ventricular fibrillation or ventricular tachycardia. This is a chest radiograph and a nice diagram of an ICD placement. Pacemaker versus ICD. How is an ICD different from a pacemaker? Pacemakers are used to control heart rate, preventing it from going too slow or too fast, while ICDs are used to prevent cardiac fibrillation. Pacemakers are more temporary solution to consistently correct heart rate issues, while ICDs are permanently safeguard against sudden cardiac death. Is ICD a pacemaker? An ICD has the ability to act as a pacemaker. However, it can also detect dangerously fast rates called ventricular tachycardia or ventricular fibrillation and then stop them. Pacemaker versus ICD. Here's a radiograph with both. Dialysis catheter. A dialysis catheter is a catheter used for exchanging blood to and from the hemodialysis machine of the patient. Here's a chest radiograph and a nice diagram of a dialysis catheter. Nasogastric tube. A nasogastric tube, or NG tube, is a special tube that carries food and medicine to the stomach through the nose. However, it's more used for suction. Depending on the facility, a, a nurse, PA, or doctor with NG tubes, the placement would be obvious. So when they hook it up, the low intermittent suction, there should be return of gastric contents. If there isn't, they need to confirm with a KUB. So if the patient decides they can't talk or they go in respiratory distress, then the tube may be in the wrong place. The OG tube, or the orogastric tube, is the same tube used as a NG tube. However, it is inserted in the mouth instead of the nose. So the nasogastric tube and the orogastric tube should end in the same place. So check the correct position. The tube should bisect at the carina, so you see it coming down. The tube crosses the diaphragm midline, and then the tip should sit below the diaphragm into the stomach, as seen here. Here are two other radiographs showing the NG tube placement. Postpyloric. The nasoduodenal feeding tube is inserted in the same manner as the NG tube, but it is allowed to pass into the duodenum, usually with assistance, either endoscopic or radiological. This is used to overcome the problems associated with gastric stasis. It is also referred to as a post-pyloric NG tube. Dubhoff. A Dubhoff tube is a small bore, flexible nasogastric NG feeding tube that typically has an inside diameter of about 0.15 inches or 4 millimeters. It is generally used to administer nourishment and medicine to people who cannot ingest anything by mouth. The tube is inserted into the stomach by the way of nasal passage. Correct placement in the body usually is checked by an X-ray. This tube is not used for suction. Unlike a tube for use for gastrointestinal drainage, there is no suction attached to a Dubhoff tube. It is a smaller, more flexible than other tubes, therefore it's usually more comfortable for the patient. The tube is inserted by the use of a guide wire and called a stylet, which is removed after the tube is in the correct placement and has been confirmed. This is a radiograph of a Dubhoff placement. You can see the tube coming down and you can see it coil around and into the stomach, and you can see the tip right here. A gastrostomy or G-tube is a tube inserted through the belly that brings nutrition directly to the stomach. Enteral feeding and medication administration if they are unable to swallow. A feeding tube is also called a PEG tube, a percutaneous endoscopic gastrostomy tube, and sometimes we have to use contrast for those exams with an abdomen to see if there is correct placement of a PEG tube. UV line. The umbilical vein can also be used as a route for central venous pressure monitoring in the neonatal intensive care unit, the NICU. If a small infant has a umbilical vein catheter, a UVC, the preferred catheter tip placement is in the inferior vena cava, above the level of the diaphragm, usually between T8 and T9, that is, above the liver. Many lines for pediatrics. This are usually for our NICU patients. We have a ET tube line coming here. Then you have an NG tube here. We have an ECG lead here with the little sticker. Then you have a UVC line coming in here, and then a AC line coming in here. Okay, so a UAC is a umbilical artery catheter. A UVC is an umbilical vein catheter. They are used in the NICU on our neonatal intensive care units to provide quick access to the central circulation of a premature infant. UAC and UVC lines can be placed at the time of birth and allow medical staff to quickly infuse liquids, inotropic drugs, blood if required. An alternative line would be a PICC line. Benefits are the need for staff to handle the baby, which may be important for premature or sick baby. Fewer needle sticks, better delivery of important nutrients, fluids, or medicines, the ability to continuously monitor the baby's blood pressure, easier for blood gas sampling in order to check the lung function. So the ECG stands for the electrocardiogram. The ECG is a medical test that records the heartbeat on a paper graph or the computer screen in the form of electrical impulses. This was just one that was left on there. There's usually several. The end. So I have a PDF of tubes, lines, and catheters that have these with some example pictures, the function and desired location. Definitely try to print that out because you really should know as a radiographer what these lines are and where they should be.